Good day, everyone. I am Ayan Francen A. de la Serna from 12F and Group 22. So today I'll be going to perform my return demonstration about the intradermal administration. So prior to conduct the procedure, the first thing that we need to do is we need to check the doctor's order and check the medication administration record. Check the label carefully against the EMAR to make sure that the correct medication is being processed. Follows the 3 checks for administering medication. Read the label on the medication when it is taken from the medication cart before the withdrawing the medication and after withdrawing the medication. Organize the equipment and prepare the medication vial for drug withdrawal. Mix the solution if necessary by rotating the vial between the palms and the hands, not by shaking. Some vials contains aqueous suspension which settle when they stand in some instances. Shaking is contraindicated because it may cause the mixtures to foam. Remove the protective cap or clean the protective cap from previously opened vial with antiseptic wipe by rubbing in a circular motion. Antiseptic cleans the cap and reduces the number of the microorganisms. Withdrawn the medication, attaches a filter needle as agency practices dictates that to draw up the premix liquid medication from the multi-dose vial. Remove the cap from the needle, then draw up into the syringe the amount of air equal to the volume of the medication to be withdrawn. Then, carefully insert the needle into the upright vial through the center of the rubber cap, maintaining the sterility of the needle. Then, inject the air into the vial, keeping the bevel of the needle in the surface, above the surface of the medication. Then, draw the prescribed amount of medication using either the following method. Hold the vial down, move the needle tip so that it is below fluid level and withdraw the medication. And let's proceed to the administration. Explain to the client that the medication will produce a small wheal, sometimes called a bleb. A wheal is a small raised area like a blister. The client will feel a slight prick as the needle enters the skin. Hello, ma'am. Good morning. I am Ayan, your attending nurse for today. So, may I now know your name, ma'am?
Laika,
Okay, so when is your birthday?
February 19.
Okay, so today, ma'am, is I will be going to do the intradermal administration. So, it is done for us to know if you have any allergy or if you have skin sensitivity. Okay, so I have already closed the curtains so that no one from the outside can see us. Select and cleanse site. Select the site or the forearm about a hand's width above the wrist and 3 to 4 fingers width below the antecubital space. So here, then avoid using sites that are tender, inflamed, or swollen, and those that have lesions. Then applies gloves as indicated by agency policy. Okay, so cleanse the skin at the site using a firm circular motion starting at the center, widening the circle outward, allows the area to dry thoroughly. Then, prepares the syringe for injection. So, I will remove the cup of the needle while waiting the area to dry thoroughly. Then expels any air bubbles from the syringe. Small bubbles that adhere to the plunger are of no consequence. Any small amount of air will not harm the tissues. Grasp the syringe in your dominant hand close to hub, holding in between the thumb, forefinger. Hold the needle almost parallel to the skin surface with the bevel of the needle. Up the possibility of the medication entering the subcutaneous tissue increases when using an angle greater than 5 degrees. Okay, so now let's proceed for the injection of the fluid. Okay, so ma'am, mag-inject na ko ma'am ha. Okay, so with the non-dominant hand, pull the skin at the site until it is taut. For example, using The ventral forearm grabs the client dorsal forearm and gently pull it to tighten the ventral skin. Taut skin allows for easier entry of the needle and less discomfort for the client. Then insert the tip of the needle far enough to place the bevel through the epidermis to the dermis. Then stabilize the syringe and needle. Then inject the medication carefully and slowly so that it produces a small wheal on the skin. This verifies that the medication entered the dermis. Then withdraw the needle quickly at the same angle at which it was inserted. Then activate the needle safety device. Then applies bandage if indicated. And do not massage the area because massage can disperse the medication into the tissue or out through the needle insertion site. Then removes and discard the gloves. Then perform hand hygiene. Then circles the injection site with ink to observe for redness or induration or the hardening per agency policy. Okay, so ma'am, do not massage the area, okay? Okay, so then document all the relevant information, records the testing material given the time, dosage, route, site, and nursing assessments. Then evaluates the condition of the site 30 minutes depending on the test, measures the area of redness and induration in millimeters at the largest diameter, and documentation findings, documents if the client had a positive or negative skin test result. Then follow agency protocol on labeling of allergies. And that's all for my return demonstration about the intradermal administration.